The following portion of Studio 512 was sponsored by CPI Health. Capital Pain Institute offers comprehensive pain management services, including a new service called Targeted Drug Delivery, or TDD. Dr. Raj Patel is here to tell us more about it. And Dr. Patel, what is it? What's TDD and how does it work?
So targeted drug delivery allows us to utilize a microfraction of medications and deliver them directly to the vicinity of the opioid receptors and pain receptors in your body. The process for it involves an outpatient procedure with a couple days of recovery thereafter. And with that, we have a reservoir that's roughly fits in the palm of my hand, and a tubing that connects to it that's about the size of a guitar string, and that's what delivers the medication.
Let's talk about who'd be a candidate for a pain pump, because my understanding is this is usually someone who has not been dealing with back pain for just a little while. This is kind of getting to that last resort type feeling.
Exactly. This is for patients that have a moderate to severe amount of pain and disability and that have really failed a lot of the other conservative options and are looking for what else is there to help control their pain in an effective fashion. Patients with cancer treatments, metastatic cancer burden, those can become a significant source of pain, and these patients can have often big challenges just with pain control, besides the fact of the treatment of cancer, dealing with cancer in and of itself. So that population of patients who are dealing with some debilitating pain from their cancer, that's certainly one big bucket of patients that may be good candidates for it.
Lovely. Okay, some of the benefits maybe of TDD over something like oral medications.
Yeah. So if you think about when a patient takes an oral pain medication, it's absorbed in the stomach, it gets taken to the liver breaks it down into little metabolites or pieces, and those are ultimately what travel to the pain receptors in your spine. So here, with targeted drug delivery, you're bypassing that system and delivering this medication directly to the vicinity of those pain receptors.
And then, of course, it's not like you just load the cassette one time and send them out the door. This is the start of a relationship about what works best for them.
Exactly. So we see our patients kind of in regular intervals thereafter. And the whole premise of that is we want to assess how they're doing at the dose that we start them at. And then thereafter, we can, again, continually make adjustments to that dose. If we need to titrate it a little bit further, make stepwise increases, we can do that in sequential steps in a very controlled fashion.
Okay, Dr. Patel, we appreciate your time. Thank you.
Thank you so much.
Capital Pain Institute has multiple locations in the Austin area. Find the one nearest you at capitalpain.com. The preceding portion of Studio 512 was sponsored by CPI Health.